A trip to the market takes a little longer for Andy Lutz. Andy has several food allergies, so before he buys anything, he reads everything on the label. But a few years back, no matter how cautious he was, Andy started having reactions to food for no apparent reason.
I referred to it in my house as my irrational fear of choking, because I thought it was just I had psyched myself out.
Turns out it wasn't irrational at all. Doctors diagnosed Andy with EOE, or eosinophilic esophagitis. It's a mouthful to say, and for a growing number of Americans can make it dangerously hard to swallow.
In worst case scenario, they might actually get a food impaction where they swallow and the food actually gets stuck in the esophagus and it needs to be removed.
Dr. Princess Ogbogu is an allergist at the Ohio State University Wexner Medical Center. She says doctors aren't sure what triggers EOE, but they do know immune cells called eosinophils cause the esophagus to swell. In some cases, it's nearly swollen shut. Diagnosing it can be tricky because in most cases, the swelling is very gradual, and EOE can affect people who aren't even aware they have allergies.
Patients may be eating foods that are causing the eosinophils to go to the esophagus without knowing it, and maybe over time they develop enough inflammation that they start having symptoms.
Those symptoms include trouble swallowing, abdominal pains during or after meals, or acid reflux that doesn't respond to medication. If a biopsy confirms EOE, an allergist may change your diet or give you a topical steroid like this, which will help reduce swelling and your risk of choking. At Ohio State's Wexner Medical Center, this is Clark Powell reporting.